Well, welcome, everyone. This is Jeannie White, the producer of this show today from Passionate World Talk Radio, and the host of the Whine and Cheese is Sheila Wilson. Welcome, Sheila.
Thank you, Jeannie. Thank you very much. As you said, my name is Sheila Wilson, and I am a nurse, and I'm also a host on Passionate World Talk Radio with Lillian Caldwell as the CEO and Jeannie White as our station manager. This segment of Whine and Cheese is about updates on the personal equipment, protective equipment that the nurses have actually not ever used. They use an unsafe masks. We'll have another segment of the Whine and Cheese in the future. But right now we're going to start discussing the unsafe masks and why they are being used and what we can do about it. It's been over 3 months that all our nurses and other essential healthcare workers are wearing masks that have been sterilized, and that has never been proven to be a safe method. And before we even start, Beckett, maybe you could answer this question. I don't know if you read the information on the Mass Nurse Association and the National Nurses United to call for the halt of the
decontamination.
Yes. But this Jane Thomason, the lead industrial hygienist, I think I'm reading that right, why weren't any of our infectious disease nurses involved in any of this?
Because they would tell them it's ridiculous.
Oh, okay. All right.
I the sad thing is that I think that, like, our nurse manager for our infectious disease is extremely well educated, and I can't speak specifically for her, but I can't see her saying, that this is okay, or any nurse putting themselves at risk of reusing a mask like that. It was bad enough when we have changed the CDC standards how many times in those first few weeks from, we would wear an N95 in, and then that was it for that patient. You didn't reuse it. You didn't keep it on. Then we went to, you have one for the shift, all patients. Take it off, put it on, take it off, put it on. Put it in a Tupperware container. No, that's not good. Let's put it in a paper bag because the paper bag will allow it to dry better. Well, we'll use it every 3 days. So you have 3 masks that you circulate over 9 shifts. It just kept changing. And none of it was practice proven. It was just what they needed to do to get by at the time. So, and there's not enough studies. There's not enough research, what's going to happen to nurses that were forced to use those masks down the line. Do they end up having respiratory issues, medical issues because of that? How truly effective were those masks afterwards? I know that at our hospital, we really balked against it as nurses. We refused. And they have now stopped that practice.
So what are you doing now?
So we get an N95 a shift if we are in a COVID area. Other than that, they're giving surgical masks as you enter the building, and then you trade it on your unit for an N95 if you have COVID patients.
Now, if I'm not mistaken, and maybe Liz, you can say something about this, the N95, I thought I was tested for those before we even got any. Are you tested for them?
You have to be fit tested.
Right.
To determine which one would be what best used for you. So we have, right now we have 3 different masks. There's an N95. I actually don't know what the green and white stripes ones are, but they like twist under the chin, and you have to properly see them above. And then the duckbills. I love the duckbills, but they don't work for me. So they would have to find one. And if they didn't find a mask, they also had a couple others that were very specific. Like, I know there's like this blue mesh-looking one. If those don't work, then you end up with a PAPR.
So, and the PAPR is okay?
The PAPR goes over your head like a hood.
That's kind of. Now, have you signed any consent, or has it been brought up to you that you should sign a consent to be wearing any of these masks?
The reusables or the N95s?
Any of them.
The reusables.
Are you saying you are okay?
We've been fit tested. We get fit tested every year for the N95s. I still don't like the fact that we're doing one a shift, unless it becomes contaminated or soiled. Because just at that fact, then I'm protecting just myself. Because I don't know what room I've gone into is contaminated.
Right.
A PUI could be positive COVID or negative COVID, and we won't know for a few days. So now afterwards, when I've gone into other patients' room, my mask contaminated.
Right.
Right.
And all of those patients also are wearing masks, but they're not N95 masks, so they're wearing just surgical masks. I just from a common sense point of view, it's not the best practice. It really isn't. It's just not the best practice.
No, it's not.
So, has anybody brought up the fact that all of you nurses that have been wearing all of these masks that have been sterilized and everything else, you should be evaluated by a pulmonary doctor?
We didn't even really get to the point where we were wearing them, honestly, because if you made sure that you had makeup on or powder or foundation, they couldn't be reused or recycled.
Right.
So if you got any makeup on it, anything like that, it could not be reused.
Well, at least you got a new mask.
Yep.
Well, that was a good thing.
And we also just said we're not doing this. This is not best practice. This is not proven, and we're not doing this. So,
that's good. Bravo to you nurses for doing that, because a lot of other nurses didn't have that strength, or they didn't feel like they had the strength and power. But bravo to you for doing that. You protect your patients, and you protect yourself.
I'm very blessed to work in a hospital that has a very strong union, and we're very supportive. We try to be very supportive of each other. So.
And that's what a union's for.
Yep.
So what is happening now with all the patients? Are you getting more patients, less patients?
We're down in numbers, which is good. Actually, I was told this morning that we have none right now in the ICU, which is the first since end of February and beginning of March.
Wow.
But I'm really right now waiting with a bated breath to see if we get a surge within this week or next week from all the protests and riots and, the reopening.
Right.
I have a question.
Really, the next couple of weeks are going to test us.
Okay, whoever said they have a question, please.
This is Sue. Hi, girls. I'm your layperson, so I'm very unknowledgeable regarding a lot of the medical terms and things of that sort. But my question is, who am I speaking with, and what town are you calling from? What state, let's say? Because I'm calling from California.
Oh,
I'm Beckett, and I'm from Massachusetts.
Okay, super. So most of the nurses from Massachusetts?
Yes.
Oh, we're all from Massachusetts.
Okay,
yes, we're all from
I just wanted clarification, because every now and then we get other people from different states, and they have different stories. Thank you, ladies.
Yeah.
Thank you, too.
Well, that's fine. Do you have another question, sir?
Yeah. The gear the PPE gear, the masks that the nurses are getting, how are they comparable to the mask that the patients have? Is it like...
They're not comparable.
Okay, thank you.
Let me clarify that.
Sure.
If we are in a PUI, so a person under investigation for COVID, that they're suspected to have it and they're getting tested and we're waiting, we will wear N95 masks for those for the rest of our shift. if we come in and we are working an assignment that does not have any COVID patients, like there are certain areas of the ER that we don't typically have a possible, like a COVID or a possible COVID patient in, then you just wear a regular surgical mask. And they are probably the cheapest things I've ever seen in my entire life. You literally put them over your ear and the elastic snaps. We've retied them. It's absolutely asinine. Actually, it's caused me to break out like all around my face because they're so bad and they're so poorly made and fuzzy.
Is that what the patient's wearing?
It's not from pressure. So that's what they get on the way in.
Oh.
The same thing that we get on the way in. So depending upon the size of your face, it's either way too big. There's no pediatrics. There's, it's
one size fits all.
They would probably be better off wearing a bandana.
Right.
Right.
At least you can tie it to fit.
Right. Exactly.
Right. Wow.
Every time I put one of those masks on, my glasses fall off. It's so uncomfortable, and I can hardly breathe in it. I don't know how you girls have
12-hour shifts in the N95.
Yeah, I don't know how that works.
It's now become standard.
Yeah,
it's awful.
Yeah, it's so.
I really don't know. A lot of people will wear their masks down to their upper lip.
And that doesn't work.
They say that that's about as effective as taking the tip off a condom. So it's really, why do they
That's
even
an interesting analogy.
I know, isn't that weird? But that's what it was, It's just, you either wear the mask full face or don't wear the mask at all.
I think I'd rather take the consequences of COVID than a broken condom.
I know. That's right. But that is really weird.
I'm too old to do all that stuff again.
We really do have, it's crazy. But that's a nurse's humor.
You have to. And in like the first 2 weeks, I'll tell you, like the first 2 weeks of wearing the mask all the time, every single one of us had headaches, and we were complaining about headaches and just feeling exhausted. And I would get a third into my shift, and I couldn't stop yawning. And I think it was just the oxygen. You're just not getting enough oxygen.
That's what I was going to say too.
And then there was also that panic. Like you could, like there was points where I remember talking myself down, saying, "No, you can literally breathe. It's just cloth.
Right. Just
breathe. Slow down. You're just having a little anxiety because you have this thing on your face for 12 hours." And now we're how many months into this? It's kind of just standard. I'd rather have an N95 on than the paper cloth surgical mask. And you kind of get used to it. I hate to say it, but we still get headaches. I'm still yawning, but it's not at the very beginning of the shift. It's more towards the end.
Yeah.
And I never yawned. And I'm going to just clarify this. I would do 12-hour shifts without an issue.
Right.
This has been what I've done my entire nursing career. So I would never get to the end of a shift and be yawning. Now when I got to 24 hours without sleep, I might. But 12 hours was never an issue because I always made sure I sleep, and I still do. I do the same practice. But it was definitely because of the mask that I was having these big yawn attacks. And I think it was just the body struggling to get enough oxygen.
Absolutely. I'm curious if any nurses had tried to put an oximeter on during their shift just to see. But it might not even be enough that your oxygen would drop low, but you're just not getting the abundance of air that you ordinarily would.
I can't see, like, in the emergency room that being able to be done, because I would, a majority of ours when we're doing is while we're working, and we're working fast, and we're breathing hard.
Yeah.
And now the adrenaline's pumping because you've got this patient that's crashing. You're in full PPE. You're dehydrated. You can't drink. You've got the N95. You've got the goggles or the face shield on. You've got head coverings. You're covering your entire body to try to protect yourself from this. You're sweating bullets, and now your adrenaline's pumping. Your heart's pumping faster. It's trying to circulate oxygen, and you've got a mask. So I can't imagine if anybody actually did a pulse ox, like baseline pulse ox, but then put yourself under those conditions and have that increased factor.
I'm quite sure that you would drop.
Yeah.
You just can't. You cannot get enough air in.
Yeah.
That kind of leads me to the. I don't want to get off the subject, but it kind of leads me to the PTSD conversation.
Right.
I still feel, that there's probably going to be another surge. That's what you're waiting for, right, Beckett?
Mm-hmm. I'm waiting for the other shoe to drop.
Yeah, it's going to happen without a doubt. And I just will mention one thing. I do know that Boston University is doing a research study, and it's called it's the anxiety-related disorders is recruiting nurse participants for a very important research study entitled Through the Eyes of Nurses, COVID-19 and Mental Health Functioning. And I'll just read just a quick thing. It just says the purpose of the study is to examine the impact of the COVID-19 virus on behavioral and mental health outcomes among nurses, including PTSD, post-traumatic stress disorder, generalized anxiety, suicidal ideation, depression, and poor health behaviors as a result of exposure to COVID-19-related traumatic events. I mean, this is another thing, particularly for the healthcare providers, but if there's anyone out there that's interested, it's on the M&A website. So, and also we mentioned last week about the M&A has some resources for nurses to get some help if they're suffering right now, which, I know that things are getting better, but how are they going to prepare themselves for the next onslaught? How are you going to? It's like you want to talk about self-care, but you won't even have enough time to do self-care when the next thing hits.
The nurses will be back in crisis mode if they're even out of crisis mode right now.
Yeah.
I've seen another study also being done on violence against nurses. So, felt like they were bullying through the eyes of the. I can't remember where it is. I'm trying to find it right now. But there was one being done that was going to study. They were doing a research and study on if you felt that you were being bullied or intimidated or harassed during the pandemic by management, which I think is going to be another portion of this, like just not feeling that you're safe at work and the pressure being put on you to not be safe.
Right, and like one of the things I think about management, the way the complaints about the financial end of it for them, that they had so many losses and so forth because they couldn't do ordinary surgeries and scheduled treatments in the hospital for people and their financial losses. But when I look at someone like the bigger hospitals, like Mass General, Brigham and Women's Hospital, right now they're doing a merger. They are merged anyway through partners, but they're having a rebranding, and they're spending $100 million on that.
Oh, my gosh.
But they didn't provide the nurses. Those nurses wore the decontaminated masks. And, it's just, when you look at it that way, it's like that's an abuse right there. That's when you read something like that and you're a nurse and you work in one of these facilities, you're like, okay, first of all, they're trying to do a pension freeze, they're going to arbitrate the contract at the Brigham, and they're putting a freeze on pensions and anything else that will be available for benefits, and probably they're going to try to takeaways. So for nurses to be like, first of all, you're like, why would I even want to do this anymore? How am I valued in my position here? My life is not valued. So the violence is a mental one as well. It's overwhelming.
It's very overwhelming, and the violence hasn't stopped. we talk about the virus, but people are still assaulting the healthcare workers, and they're getting really hurt. And they're assaulting them, as we said before, in the supermarkets. They're assaulting them on the trains, on the buses. But what's going to be the outcome of all this? Sue, can you respond to any of this?
I can. I'm just kind of in awe and wow. I'm listening to. It's just frustrating. What I can respond to was coincidentally, girls, they were meeting today, and when I say they, the government was meeting today. Hold on one second. And it was the Ways and Means Committee. At 2 o'clock, it was a webinar podcast. The subcommittee was the Health, the 116th Congress. And the title of the webinar was Examining the COVID-19 Nursing Home Crisis. Now, I know you guys aren't in a nursing home or anything, but what got my attention even earlier, because I've been listening to the Center for Medicare and Medicaid Services for about the last month and a half. Every week they've had a webinar with a lot of other advocacy organizations. And it's not great. I mean, everybody and everything's in chaos from top to bottom, whether it's skilled nursing facilities, where it's PPE gear. Coincidentally, back to the Ways and Means Committee today, it was reported, and I just, when I logged on, I didn't even find out who the person was because it was just after the fact. It was reported that the government handed over the PPE gear issued to the governors, who then handed over the responsibility to the nursing facilities. Originally, 2-week supplies of PPE gear was issued to the nursing facilities. However, there's no PPE gear in place per the White House. Hospitals, since the facilities are vying for PPE gear, everyone got into competitive pricing, leaving the skilled nursing facilities dry. There was a Florida representative, Calhoun, reported that 85% of his deaths were seniors. Apparently there was another representative that said they're currently, I don't know, I don't think it's out there yet, but there's $175 billion to PPE gear. And they just want to make sure that it gets to the nurses, to all the medical staff, and not to other management and things of that sort. Arizona also mentioned they were not getting any PPE gear. And she felt, the Arizona representative felt, that the skilled nursing facilities should be a priority. Like I said,
it should be.
Yeah, definitely. Like I said, it's just, I'm more of an advocate for the elderly with regards to skilled nursing facilities, because a lot of these facilities have been out there, and even they noted on this committee that this isn't new, the lack of gear and or help for these facilities. They've been, there should be no immunity granted, because they have this history of poor, management and things of that sort. So, like I said, that's what kind of got my attention. And in addition, there were different states and advocates and ombudsmen talking about the lack of PPE gear, the lack of help. There's no ombudsman able to go out, or the state inspectors aren't going out. The only ones who are going out is your health department. And so I've been getting on my different Facebook pages that I'm a member on, and I'm telling the caregivers, if you have any issues, contact your public health department, because the ombudsman or the state inspectors aren't going out there.
I had one of the nurses that works down the south part of, the Cape Cod area. They found out that they were told that they had plenty of PPE, and they were thrilled because they thought that they would get more than one mask a shift.
Right.
But what their masks were, they opened the hospital to visitors. Visitors can come in twice a day. And when they come in, they have to sign in, and they get handed a mask, gloves, and surgical gown. And they have to wear that while they're in the hospital and then dispose of it. They can't take it home because it's dirty. And they can come back in twice a day, and they get that whole gear again. Now, how would you feel as a nurse that's running around with you? It's just
for hours on end.
Right. And is your hospital opened now for visitors, Beckett?
It is, but we have the stipulation of they can only come in 10 to 7. It's only one visit. It's for 30 minutes. And that's it. And actually in the emergency room and in certain areas, we're still not allowing visitors.
It's terrible. It's absolutely ridiculous.
As a nurse, if you're giving visitors twice the amount of gear for their 30-minute visits, 1 hour a day, than I was getting for my full 12-hour shift, I'd be livid.
Right.
Yep, that's exactly what's happening. They're furious. And so...
Yeah, I don't blame them.
But then you have to ask yourself, why do we stay? Why don't we just walk out and tell the managers and the supervisors and the CEOs, you take care of people. You wear one mask a shift. Can we do that as nurses?
You can, but it's my understanding, on the other hand, is this is more information that the National Guards have been stepping in. Now, that's interesting because I don't know what type of medical education they have, but they've been stepping in, and this is on nursing homes that I'm talking about. They've been, in addition, what I found out in one of the webinars, they mentioned that it's my understanding a CNA has to do like 40 hours and maybe 3 or 4 months of internship. Don't repeat me, but that's my understanding. And because they lack CNAs, they're going to turn it all into like an 8-hour test, an 8-hour study and test for the CNA.
8 hours?
Mm-hmm. And they're going to give you a certificate, and you're now a CNA.
That's not acceptable. Because they have to be able to do a bath effectively, take a set of vitals, help to ambulate that patient, toilet them safely, and then also you're going to put them under my license.
Mm-hmm. Mm.
And they're going to bathe them.
They have a certification. They don't have a license. So if anything goes wrong, they come back at the nurse.
That's right.
Right.
The nurse becomes the scapegoat, as always.
And how many patients?
Yeah.
Well, so I can say something as the National Guard because literally one of our nurses just came back. She's enlisted, not full-time, obviously. She's like the National Guard, but she got called in as soon as COVID started. Her unit got deployed. And she has done some nursing assignments, but also she said her last few assignments were full turnout gear, full, head-to-toe coverings, and she was working as a CNA in a nursing home. And she's like, I was doing 40 bed baths a shift.
Wow.
Just because they didn't have enough staff. She's like, I just went from patient to patient to patient and washed them.
So what is that, a 2-minute wash?
Yeah, 8-hour shift, 40 people. I don't know.
I'm sure she worked.
And I'm not sure if she was doing 8 or she was doing 12, but she was exhausted.
That's almost
and then on top
impossible.
of it, you're in the full PAPR gear. You're in the full hazmat suit doing this.
That's
wow.
She's like, that's all I did was I washed people. She's like, so that's what they were using them for. They were using RNs as CNAs.
Mm-hmm. Wow.
And it just, I can't get over that CNA. I started off as an EMT, but I also did do the CNA course, and it was 2 weeks, every single day, 8 hours. You came in at 7, you were out at 3. Classes, tests, books, competencies. I just can't imagine doing that in an 8-hour day.
Right.
Not if you're taking care of patients.
No, we're not. This isn't a factory job to teach you how to punch a hole in one part over and over and over again. This is multiple different skills that we rely on to make sure that patient stays healthy. If that individual comes back and isn't able to competently take a blood pressure or a pulse, and they tell me it's normal because they're afraid they don't have the skills,
right?
And now the patient's crumping, and I have no idea why as the nurse, because the vitals were fine, so now what are we looking for? And now all of a sudden the vitals are not fine? No. There's so much that you can catch from vital signs that give you an indication that something's going wrong, that hopefully you can intervene and take care of that issue and help that person. You don't want to wait until they're showing signs of their vitals being bad.
Right.
There's no time to walk and talk with these
patients. Are charged so much money to be cared for, so much money.
Right.
And many of them lose their whole life, their homes and everything to be taken care of, and it's thousands and thousands of dollars a month for a patient. And I put it on the owners of these facilities. I really do.
Oh yeah, that's rampant too. It's sad. And then I'm sure you girls heard several states were granted immunity in reference to all of the facilities. And it's just a sad. I live here in California, and they haven't done that yet here in California, but there's a good 15 states that were granted immunity during this pandemic situation. And it's sad.
Immunity from what, Sue?
Well, in case there's a problem in a facility.
Taking the responsibility of the facility in case of death and anything.
Like Holyoke, what happened in Holyoke? The veterans home?
Like that kind of situation, It was.
How could that even happen?
I know. It's just that's what got my attention. To be honest with you, I started listening to him, and I thought, no, you got to be kidding. But let's talk about it a little bit more. And I'm thinking, okay, these are people in skilled nursing facilities. They're just obviously disabled, okay? But let's just say you or I get in a car accident and we need to go into a skilled nursing facility for rehab. Guess what? Whether it's intentional or not, I'm abused, or they walk me to the bathroom and they leave me there for hours and I fall and hit my head in the facility, guess what? There's nothing that's going to happen. They're granted immunity in that facility. That's not right for anybody.
No.
Whether you're disabled or not.
That is just, that's another fight.
It is. It is. There's so much.
Yeah, that's
it's sad.
It certainly is.
And then we're talking back to the PPE gear. I mean, you guys are just opening my eyes even that much more. And like I said, I just listened to this meeting, and that was a big eye-opener for me, too, because it's all chaotic there, too.
Right.
It's awful.
No one's on first, and the White House is not helping at all, period.
No. My concern still is the fact that the nurses are working in high gear. They're in crisis mode every single time. They don't have enough time to get out of this crisis mode. And who's going to take care of them? Is this going to be like the Vietnam vets that came back and all of a sudden they have mental health problems and nobody cared, nobody took care of them?
That's like the 9/11 situation.
That's right. And the other thing is the fact that they're wearing these masks. They're saying don't smoke because the smoke will cause lung damage. Oh, now the vaping. Yes, it was okay. You can vape, but no, don't vape now because it's going to destroy your lungs. But let these nurses wear these decontaminated masks for 12, 8, 4 hours at a whack, and nobody thinks anything about that?
Right.
Right.
Well,
I have a question. I have a question, too, because I saw this was a couple of months ago, and there was a nurse, I don't remember what state she was from, but she got very frustrated, and she spoke out in reference to the CDC changing their guidelines on the masks and things of that sort. How many times has the CDC changed that law or that situation? And
their recommendations. Their recommendations. Yeah.
I don't want to say recommendations, or is it just they changed the way they're making the masks for cheaper costs, I'm thinking, for rationing of money and things of that sort.
But so they don't create the law. What they do is they make their recommendations or their guidelines. Guidelines might be a better term for it.
Okay.
And then the hospital can use that as a crutch to screw you over.
Right, there you go. Exactly.
Right.
It's what it comes down to. So that's pretty much what that comes down to. And you think about it, when we first started using N95s, typically it was for a possible tuberculosis patient. It was underneath, when we went through the whole Ebola, you wore them underneath your Ebola hood. And it was, you used that mask in the room. You were allowed to reuse it for re-entry on that patient if you kept it inside, but it was only good for that one patient that one time.
Wow.
And that was it. And you would dispose of your gown as soon as you exited that room. So you would use a new gown every time you came in and out, new gloves. Nothing was reused. And then all of a sudden it was, okay, well, you can wear it for, I want to say initially it was, you can wear the mask for 4 hours. 4 hours is good. Now it was, you could wear the mask for your whole shift, 12-hour shift. Then it was, well, that one mask should be able to last you 3 shifts, but you should give it a couple days to dry in between. So we put it in a plastic bag. So you were using, 3 masks over 9 shifts. So 36 hours for one mask. So we went from, you used it for as long as you had that patient, that one patient, and not with like multiple patients, to use that one mask for all patients for your whole shift. And then for 2 more after that.
Yeah, it's even just common sense. Even anyone that had no information about infection would know that is unacceptable.
Yeah.
And that is just a disaster.
The FDA actually took the same stance as the M&A on it was June 7th, I believe, if I'm correct, but they took the same stance as the M&A on the sterilization of masks, and which is that it's not effective, it's not what we should be doing, and it's poor practice.
Yeah.
So even though the CDC has been bought by the hospitals, the FDA still is keeping at least some common sense.
Yeah. Yep, those hospital lobbyists have so much power. People don't have any idea.
Oh, no. I think it's the medical lobbyists, hospital too, but do you know there's 3 for every senator on the medical side, 3 lobbyists.
Just
hospital, 3 medical lobbyists for every representative there is.
Right. Well, you and I, Sheila, we met the American, the hospital
lobbyist. Yes,
lobbyist. The Massachusetts Hospital Association lobbyist.
Right.
Whatever they say goes. Period. Doesn't matter how many bills did we have go to study, never came out. We fought for years. And they get up and say one thing behind closed doors, not even in front of the public, not even after every single person would testify. They're the ones that have the power, and they give, what they do is get the power. It's the hospitals that pay them, you know?
Well, and it's not just that. It's the corporations that they belong to that then you don't know who sits on what board. I know this sounds so conspiracy theory, but after question 1 here in Massachusetts, like sitting down and putting together who knows who from what and where and who sits on what board with each other and who makes who money, and it's ridiculous.
Yes.
It's so corrupt and so dirty.
Yep. Yeah, we just saw a little speckle of it.
It's something out of like a psychological thriller movie, but it's truly going on.
It is. Wow. It is. It's not even, I don't even think of it as conspiracy. It's the absolute truth.
It's the absolute truth. But when you sit down and you look at it, you think, oh my God, this can't be really how this world works.
Yeah, it really is.
Like we really do put profit over people.
Absolutely.
Not us specifically, but that's what these people are doing. They would rather make money than save a person's life.
Yep.
I just finished a book called, hold on here, and it's a great book. It's by a physician. The Price We Pay, What Broke American Healthcare and How to Fix It. It's by a physician of the name of Marty McCary. And he talks about everything. He's very open. He wants everything to be open. And he puts it all out there. And he tells you what the medical businesses are doing. Like you said, it's money before, profit before people. All the scams that are out there. And it's an eye-opener. He also educates you on the middlemen with regards to pharmaceutical companies and DME equipment. There's a middleman there too. So it's just, I'm just in awe. It's just horrible. It really is. It's just. But he also gives the solutions too.
Oh, well, there you go. We can always use solutions.
Yeah, he wasn't just griping. I mean, he offers all kinds of solutions, but he knows it's not going to be overnight because you have to ask the hospitals and everybody else to look at a different way that they're used to, and all the profit that's involved.
Yeah, I'm 43, and I honestly do not expect to see it in my career.
Right.
It's just so corrupt.
Yeah,
so corrupt.
And you know what? And it's not just medical either. Anywhere you go, any business, it's just sad. It's just
well,
really
look at the
sad.
fact that with the government shutting down businesses, right? Mm-hmm. It wasn't Walmart that got shut or Target.
Yeah.
It was a small mom and pop.
Yeah.
Mm-hmm.
And they're the ones
where did the money go? Where did the money go? Who applied and who got the money? Stanford University in California. And I think Harvard applied for money, and Harvard got money.
And they were still getting full tuition from their students who weren't getting the full price of their payment.
Right.
It's just the full experience of living and eating, and they didn't get refunded for any of that.
Right.
Well,
so
girls,
they had all that money still.
I hate to break it to you, but our time is running out.
Okay.
And I just want to ask another question. And Beckett, are you still being floated to other departments?
Not right now. As of now, it's actually gotten a little bit better just because the numbers are down. They haven't needed us on the ICU. We've been just doing ours. We've actually, the last couple of days during the afternoon, had to shut down the tent because it just gets too hot outside. But we're starting to definitely, the numbers in the emergency room, our admissions are all starting to pick up, and it's not just the COVID anymore. People are coming back to the emergency room. And, like the fact that we don't have to reuse our N95s, the fact that we're not using them for 3 shifts, we're only using them, this sounds so bad, but we're only using them for 1 12-hour shift. Still blows my mind. But we're also, we actually got gowns that fit us, that don't rip as soon as you twist, and they're made by Ford. They actually have the Ford logo in the tag, and they're made out of airbags.
Awesome.
They're made out of airbags, so they're heavy as hell, but you actually feel like you're protected in them. And we used to have 1 per shift, and now we use 1 per patient. So we hang that just outside their room, and that's the one that we use to go in. So we're at least not cross-contaminating with the gowns.
That's great.
So small improvements, small fights. But also we did some, as I said, I'm very blessed that I'm in a hospital with a very strong union and strong membership. And we actually did a lot of steps to put pressure on management in, like, big steps. And it worked. So
that's good. All of the nurses and all of the essential healthcare workers really need a staff. It's an awful lot of caring for our patients, and I know that we wouldn't stay if it wasn't for our patients.
Right.
Yep, and that's exactly it. When you guys were asking why do we stay, we stay because we're nurses.
Right.
That's right. That's right.
It's not the paycheck, because if it were the paycheck, as soon as we were at risk, we would be out.
Right.
We stay because we're nurses. We went into this field because we have the heart to care for people. And we have the healing hands to care for people. And we want to be there in their worst time. So we're not going to desert them in a pandemic because management is a bunch of dirtbags.
Yeah, there you go.
Or the hospital or the government is a bunch of dirtbags. We're not going to abandon our patients because of that. We're nurses. We're always going to be bedside, and we're always going to be nurses. Even a retired nurse is still a nurse.
Yep.
You got that right.
Yep.
You're always a nurse. And that's why we're bedside. That's why we haven't walked out. And that's honestly the horrible portion of it, is that's what management counts on.
Yeah.
Yep, you got that right too. One other thing, the Stop Healthcare Violence Facebook has quite a few items on Heal the Healer, and one of them is the Holy Grail, and that's 21 interviews by some really solid people. And one of the interviews I listened to, and I'm saying this because of you, Becca, she talks about gratitude and a gratitude cup. And all I can think of when she spoke about this was your dad in the bag.
In the bag.
Get your bad stuff out. Put your good stuff in. And that was absolutely amazing. So if you get a chance, try to get that. It's Dr. Simon. I can't remember her first name. And then it's all free videos that you can listen to. And she interviews these people. And Patty Gage is given free Qigong exercises free of charge on Zoom. And if you're interested, just let me know, and I'll ask her to send you an invitation, or anybody that wants to do it. And my last question is, how are you doing with your face masks and your gloves? Are your hands wrinkled, and are you getting sores on your hands as well as on your face?
Does anybody else want to answer? I feel like I've been answering this whole time. But, yes, I currently have a sore above my lip. I have a sore on the left side of my nose. My hands are okay. I'm not reacting to the gloves, and luckily I've never really had a big issue with the gloves. The hand washing definitely is eating away at, like, your cuticles, and, you know, there's hangnails right and left from it. But, yeah, I still have sores, especially when we're wearing those N95s for 12 hours.
Yeah.
Right. I used to get
it's a pressure
my
sore.
skin would come off on my hands from the gloves and the alcohol.
Well, it's a pressure sore. I mean, that's legitimately what we're getting as nurses is pressure sores. So every 2 hours we turn our patients so that they don't get pressure sores, but yet we're not getting a break from those masks every 2 hours.
Yeah, they squeeze your face.
For 12 hours. I mean, you might get your 30-minute lunch break. You might take a 15-minute break. But we legitimately have found through studies that patients can do a max amount of time, 2 hours on a pressure area. And we're putting pressure on our face for 4 hours, 5 hours, 6 hours. If it's a bad shift, sometimes you don't go to the bathroom. Sometimes you don't eat. I've gone 10 hours, 12 hours into a shift and not eaten.
Yeah.
So if you have an N95 on that entire time, that's 12 hours of pressure on the bridge of your nose, on the side of your face, under your chin. The skin's going to break down. I've got more facial creams and acne treatments now than I think I did even as a teenager.
Trying to heal your skin, yeah.
Yep.
Well, let me know if you get more Holly's skin thing. See if it works. Amy said it kept her skin intact. But any other comments before we close?
I just want to thank Beckett for her service, and I really mean that. And you're just really a hero, really. I know some people don't want to hear that, but I really admire your strength and your just stick-to-itness and always putting the patient above everything.
Our patients deserve it.
Yes,
it's not something because I'm a hero or because I want people to say that or even think it. We're doing the same thing we've done all along.
Yeah, that's true.
And that's what people don't understand is that, you know what, if you think we're a hero now, we were heroes before.
Heroes always.
This is not something new. This is what nurses do. This is what caretakers, this is what doctors and respiratory therapists and CNAs and our CCTs, this is what we do.
All of them, yeah.
So it's you know, and it's not just an acknowledgement in the moment because you're realizing how much we do. You know, it's going to be forgotten in a couple of years. And I'm okay with that. I'm so tired of hearing thank you for your service. I can't even imagine how people in the service actually feel.
Yeah, I know.
So.
Sometimes you don't know what else to say, and me personally, out of my own guilt that I'm not there because I'm not at the bedside anymore because of what happened to me with workplace violence. But I really, as a nurse, just like you said, I wished I was there.
Yeah, and I have friends who are the same way, that they had to take a leave because, you know, their spouse, their parent, they were compromised or they were compromised. They're compromised. And in a basic situation, a normal everyday situation, they were okay working. But with this being taken to the level it is and how just mind-blowing it is, they haven't been able to work. And I know that everybody feels the guilt of that. As a nurse, how can you not? Like, this is what we do. So I understand, and I'm so glad that you're taking care of yourself, and I appreciate what you've gone through, and I know how well you've advocated for us that are still working right now for, you know, the workplace violence.
Thank you. I always
will.
So
I appreciate you too. Thank you.
Thanks.
Susan, do you have any comments?
No, I appreciate the invitation, Sheila.
Well, please come again, because we can always use some different insight, different states. It's great.
I'm open, and thank you, ladies, for educating me and enlightening me in reference to the service that you do. Thank you. Definitely, like I said, I'm your average lay person, although I am an advocate for the elderly as well as a community educator for the Alzheimer's Association, and I see that end of it too. But again, thank you for the invitation, Sheila, and if you need any updates or anything, let me know, because I'm definitely going to be continuing to follow the CMS and what's going on with different states and things of that sort.
Awesome. Thank you
all.
Thank
you for the invite, ladies.
Thank you so much, Sheila.
You're welcome.
Thanks, Sheila.
You're welcome.
Thank you, everyone. This is Jeannie White from...
This is the end of our talk on Whine and Cheese. Thank you very much for listening. Thank you, Lillian Caldwell, CEO of Passionate World Talk Radio, and Jeannie White, Station Manager. Thank you.
Thank you, everyone. This is the end of the conversation today. You can hear this over again. You can hear this on Spotify, Google+, iTunes, and so forth. But I'll be doing a blog on this, so I'll be going out in the next couple of days. Thank you, everyone. Jeannie White, again, from Social Connections of Passionate.